From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning on this Saturday morning, early August, Dr. Marr. Welcome to Medical Forum. I'm your host, Jeff Reed, co-host Christopher Marr, Dr. Christopher Marr from Colonial Family Practice. And last week we had Brooke Luce on, Chris, talking about all the happenings at Sumter East Health and Rehab Center. And you know, like what happens a lot on most of our shows, time catches up to us. So we got a lot of great information, but still a lot of information still out there. So we hope we have her back on.
You know, it was a great segment with Brooke last week. Sumter East Health and Rehab has really had a facelift in the last year or two. Brought in an entire new staff. I believe there's a new parent company involved, and remarkable facility.
And we both have seen the facility. I like the structure of the rooms that they have, and they put nice hardwood floors in and big screen TVs. But I think the staff is what really has set them apart right now, and tremendous work by Dr. Kim, Dr. Morrison, Robert Limmer, great PT I've worked with, Lana Kay at PTA, and of course Brooke does a great job with admissions.
Well, that's where I was really getting to is what's so important to myself and referring patients over to these facilities is what type of resources they have. And that facility has done a great job with having a multitude of specialties to take care of patients in-house, so patients aren't having to leave the facility to go out for wound care,
right?
For the rehab, having the physical medicine and rehab physician who's board certified in PM&R medicine right there to develop and continue treatment plans and protocols for the patients. Just a great facility.
It is. So, today I'm excited about our show that we're going to bring today because I think, this is our 20th show, Chris. Time moves on. We've had some tremendous guests on, and we've had tremendous subjects. And I like the idea today, our show, we're going to kind of try to recap some of the 4 or 5 things. We, of course, sponsored by At Your Service Home Care, your concierge, your steward, and your guide and beyond. And the website there is www.ays/homecare.com. And it's welcome to people to give comments about the show, any questions. And, we a few weeks ago we put on some of our top questions. But what's interesting, some of the emails that we got after last week's show, and we want to touch on those couple things about the changes. And just to clarify, one of the comments that we got on email, it is a 3-night stay. I know when we were talking, Chris, for anyone to be eligible for rehab, that they need a 3-night stay. You called them midnights, I think.
3 midnights.
Yeah.
And remember, though, one of the important things we learned last week from Brooke was that traditional Medicare has always required those 3 midnight stays in the hospital. However, the newer Medicare HMO plans do not have the same requirement, so that if acute rehab is deemed necessary and you did not have a hospital stay, your physician, your primary care physician, can admit you directly into the rehab facility without that.
And that's what we call it, the red, white, and blue card last week. But we had a couple emails addressing that, explaining, and one of them actually was someone who's not quite 65. And like we said, you're going to be engulfed by some options, good, bad, or indifferent. But a lot of people will also try to encourage you to come on with them because you will hear between 2 or 3 day stays or what have you. With the Medicare card, you might look at a different Medicare supplement, and you might not have to do that. So just to answer that question, but as we move on with today's show, one of our favorite guests on here has been Toomey Home Care Systems, and I think they've been on probably 4 times now. And I thought we would touch on some of the subjects and just kind of hit some of the highlights that Jeff Hall from the foundation has been on predominantly, but we've also had Kim Price on here a couple times as well.
And I saw Jeff, just as an aside, though, I saw Jeff practicing his putting the other day.
You know what that means?
I think he's ready. I think he's ready to give you a run at it in October, I believe.
October 9th.
Our golf tournament's coming up in October.
Well, let's talk about the foundation and the October 9th golf tournament, always on a Friday, always a big event. Great food, great prizes, always well sponsored. But any sponsorship I'm still very welcome. So get out, sign up for that. It'll be at Sunset Country Club. I think we have an early tea time with a great afternoon dinner. So, one of the things that the foundation that we've learned is that they support so many nonprofit organizations. And
absolutely, the money is well spent. It doesn't just go to support Toomey programs. It really goes out into the community and touches a lot of different programs, a lot of different lives in the community.
Well, and one of the topics, and it'll be coming around next year, time flies by us, but back in June they had their 5-miler. And we mentioned that it's the 4th year they've done it, but it's supportive. One of the hot subjects that you hear in your office every day, which is diabetes.
Absolutely.
So trying to help childhood diabetes, which I know you see as a huge problem.
And the program that is funded by that run is just spectacular. It involves going into the schools and trying to address these children before they develop diabetes. Really trying to get to the root of the problem and trying to cut things off at the pass. Right. So before that, there's diabetes in the medical record.
It's prevention, like we always talk about.
Pound of prevention versus pound of cure.
And that's the foundation that Toomey supports down on Main and Hampton, 774-9498. You can see Jeff or any of his great staff, and they can lead you in the direction of the golf tournament, the 5-miler, all of the nonprofit organizations, all the support groups, such as the Alzheimer's support group that they do. Also with Toomey, 2 of the great programs that are out there, it's the SANE program, which is a very touchy subject, and Jeff took it head on when he was here. And it is a program that we see a lot through the ER, but sexually assaulted individuals. And unfortunately, we see it all too often in the young, and all too often it's a family member. And Toomey's been extremely proactive with that plan of attack. And that just gives us a little bit of some security here in Sumter, knowing that if you are listening out there and you're young, or you know of someone, if you're a teacher and you know that someone's being sexually assaulted, or you think that they're a person that you can go see.
Yeah, and they've really assembled a specialty team that has the ability to take care of these individuals that just take a lot of extra attention, detail attention. Some of the exam is a bit of a forensic exam to collect information, but as well as helping the victim through their emotional state throughout this very traumatic event.
It's a great thing. The psych, one of the topics that the Toomey's also bringing in, I don't think it's quite there yet. You got to go through a lot of credentialing. But as you know, psychiatric patients right now have kind of taken a back seat. There's just no funding for it. Toomey on the 5th floor used to have an entire ward, and now due to no funding by the government and such, unfortunately they all end up in the ER. So they're bringing in a telepsychiatry is what they call it. And basically, if you have a patient in there, you will be able to get a hold of a licensed psychiatrist via Skype, and they can access a plan of care. So as we come up on our first break, we certainly want to thank our sponsor, Toomey Home Health. We'll talk about more with Toomey, and then we'll talk about some of the other hot topics that we seem to get most emails from. So we'll be right back after this break.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back on this Saturday morning. Thank you all for listening in. I want to thank our sponsor, At Your Service Home Care. Check them out on 1250 Wilson Hall Road or give them a call, 803-607-9677. You can also visit them on the web at www.ays/homecare.com. Just a bunch of great people there. If you need any kind of respite care, if you're the caregiver taking care of a father, a mother, a brother, a sister, a cousin, a neighbor, what have you, they're great. Come in with light housekeeping, all of them certified that where the needs are there. Take care of your patient, transport them, get them to the doctor, get them home. Just take the burden off of you to where you can enjoy being a parent or a spouse.
And Jeff, you know, the biggest issue I think that sets this company apart from the rest is the concierge level of care, and that each client is getting a individual concierge, which is someone who they can call at any time. And it's not just about getting someone in the home. There's so many other resources that are available for funding, for payment of service, resources as far as legal resources that we all need, resources for insurance.
But we talk about it all the time.
We do.
There's so many grants out there that will help somebody fund this. So give them a call again at 607-9677. They'll vector you through that system. But there are so many things out there, especially for dementia and Alzheimer's. But if you're living with a loved one who has what we call ADLs, and they have maybe two things they can't do, from sit up, eat, walk, bathe themselves, give them a call. There's a lot of help out there because these patients a lot of times, Chris, fall between the gaps, as we talk about, between what Medicare will cover and other supplements.
And care for family members is a very expensive issue, and there's, again, like you said, a lot of subsidies that can help defray the cost of the services.
Well, and, you know, we were talking about Toomey when we went to break, and one of the things that is a big item that is hitting hospitals and it's hitting people is the constant readmissions. And this is where a company like At Your Service also will help with the admissions and the readmissions. So if you have a loved one that, from diabetes to congestive heart failure to COPD, they go into the hospital and they get discharged. Unfortunately, we see so many times where they go home into an environment where they're not being taken care of. And conversely, what happens? They get readmitted back into the hospital.
And sometimes
costly.
And sometimes it's a matter of that individual not being able to get to the pharmacy and pick up their medications, get to their family doctor or internal medicine physician to be seen for follow-up to make sure that their chronic medical condition is stable and being treated accurately. A lot of it is just a matter of resources, like you're saying.
Yeah. And you know, Toomey's being very proactive. I actually sit on a committee with them where they're trying to help the individuals, because it is a constant problem, not just here in Sumter. It's across the United States, but it's also a very expensive expensive to a patient. So if I have Medicare only and I get discharged from the hospital, I've got a 20% copay cost to go back in. It's an expensive proposition, certainly sometimes more than the equipment that they might need or the like you said, the pharmaceutical needs, or the fact that they're just not being taken care of at home, and I might go in for COPD and fall and break my hip. So Toomey's being very proactive. They're there to help. So stay local. We always talk about that. There's nothing better than being here local in your hospital when you live in the community. And then if you are discharged, there's so many things out there that resources to help care, from medical equipment local to physicians, like you said.
Home health, hospice, all of these resources that we have. But again, it takes a lot of resources to care for these patients.
You're right.
Sometimes just one resource, just home health, is just not adequate to take care of all of their needs.
That's right. And as we know, home health, all of them have limitations. That's why we need to have a wealth of knowledge. So then where one stops, we'll help you, get you situated. So home health, hospice, there's so many things that Toomey and other companies like Tri-County Home Health, which we'll talk about later. Do want to touch on some final comments with Toomey. Obviously, we'd be remiss if we don't bring up the lawsuit. Sounds like we're kind of at a stalemate. No news is, I don't want to say good news, but it is what it is. So as we wait to vector through, hopefully on the horizon is two things. Hopefully a settlement that makes the hospitals whole. The government then moves on with their life respectfully, and it sounds like Palmetto Health could be a great partner for us.
Talked about Palmetto Health coming in and partnering with Toomey. Palmetto is, I believe, the first or the second largest healthcare provider in South Carolina.
Well, I do have some numbers for you. So I can't answer that, but I can tell you the numbers. So put in perspective, Palmetto Health, 10,000 employees, over $1.3 billion in revenue that they do. So they, with all the services they have, I'll just put in perspective. Toomey has 1,600 employees today. We do about $200 million. So we would certainly be a nice niche for them. What they bring us, though, Chris, they bring us a heart hospital and a children's hospital. But as much as that, they are so much like Toomey. They're riveted into community service.
Yeah, Palmetto already has several hospitals that most people are familiar with. Palmetto Health Baptist, Palmetto Health Richland, Palmetto Health Heart Hospital, Palmetto Health Children's Hospital, Palmetto Health Baptist Park Ridge, Palmetto Baptist Eastleigh Hospital. And so they already have several.
And a big acquisition
facilities.
right in your wheelhouse of more orthopedic.
Absolutely.
So we have tremendous orthopedic surgeons here at Toomey, but what's great about them is the referral basis. And one of the things Jeff emphasized when he was on, when people leave Toomey to go elsewhere to a more orthopedic, they're going because our surgeons know where their expertise start and stop. So you're going to get, if they can do it, they're going to do it, and you need to stay here. When they don't, or it's something that they don't specialize in, at a drop of the hat, they send off that referral. And orthopedics a great ally.
Patients ask me on a daily basis when I make a referral to a local physician, is this a physician that's suitable for their needs, or do they need to go elsewhere? And Sumter has a fantastic group of physicians, orthopedists, surgeons, specialists of all nature. The orthopedists have taken care of my family. And so when we've had problems, I stay right in Sumter and see the guys. And when there's a problem that they're uncomfortable with, they send them out right away. But they can take care of a lot of the medical issues, including the surgeons, the orthopedists, and do a fantastic job.
Great. One of the other things that with our industry improving, which is very exciting, with Continental Tire, just to mention that, Apex keeps, what was formerly Cooper Tool, keeps growing and bringing people in. Toomey's industrial wellness program, headed by Kurt Ackerman, a real good guy. They do the Smart Beat. About 30 minutes, you can go in there and do 4-point blood pressure tests, and EKG and ultrasound, and this can help prevent any medical problems that come down the pike. And, we're running short on a second break. But anyway, we just want to encourage everyone to stay local. research everything that's out there with Toomey, and we'll be right back after this break.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum on this Saturday morning. Jeff, we'd always talked about how important it is to use local vendors. I see this all the time in my practice. I have patients who are sent information about orthotic equipment, respiratory equipment, and I've had patients in the past use this type of equipment. They get their equipment from Florida or another state, and then months later, they have a problem with the equipment. What do? Ship it back, send it back. Sometimes the equipment is sent, it doesn't fit them correctly. So again, I recommend to everybody local. We have a lot of good local vendors. One of the great local vendors in town is Reliable Medical Equipment. You can go see them at 418 Broad Street.
It moved to 246 Broad Street.
246.
Yeah,
Broad
just
Street.
down from you.
I
Your
apologize.
old location.
Near the old location.
That's right. Yeah.
And the phone number hasn't changed, 934-9212.
That is correct.
And, Reliable, I've used Reliable for many years, actually even preceding knowing Jeff Reed. And they just take great care of patients down there. And Richard and Jeanette take care of all the orthotics, the bracing. Aubrey help you with all your respiratory needs. Thomas and Jennifer, the respiratory therapists who go out and help set up CPAP. Thomas actually worked with Thomas for several years.
Yeah.
Worked with him at clinical
You referred
practice.
him. We thank you.
Great respiratory therapist. Would love to get him fired over there and get him back in our office. But
I'll see what I can do.
I'm glad
I can see what I can
glad
do.
he's doing well. But
Yeah.
I have patients time and time again come back and say how great the service is and how thorough the respiratory therapist is. For instance, setting up CPAP. And that's just not an easy thing to do.
Right.
Getting started on CPAP for a patient who has obstructive sleep apnea is not a piece of equipment that patients usually ask for. And we know that obstructive sleep apnea is a really serious condition. Untreated, it can lead to heart attack and stroke and exacerbate conditions like congestive heart failure. And it takes time to get used to the equipment. It takes patient therapists time to help the patient work through some of their problems. But at any rate, you're going to have a better outcome with use of these equipment, better company use, and someone who can spend that time with you. And I think therapists over at Reliable really do a good job with helping patients set up the equipment and work through those initial issues that occur with the use of the equipment.
And I thank you for that. Best staff that we've ever had, we have today. And always when you get a call in, you always get a pleasant voice. Those CSRs are probably the yeoman work and the under congratulated because they face everything over there. So thank you for that, Chris. And when we were leaving the break, we were talking about Toomey and all their home services, and one of the things that we talked about was home health and hospice. And we get calls on that all the time because I think sometimes there's so many I don't want to get screwed, but understanding where hospice, where home health, and what the expectations. And I know a company that you're near and dear to with MediHome Tri-County Home Health Hospice. And, Toomey's just been a fantastic home health and hospice as well. Can you kind of, for the listeners out there who maybe are looking at that or considering home health and hospice, what is the difference? Or maybe just let's maybe bisect them down a little bit. Hospice. How do I qualify for hospice? What would the stages and steps to qualify for hospice?
Hospice is end-of-life care. It's for patients who have a diagnosis and a life expectancy of 6 months or less. So there are patients who use hospice benefits for longer than 6 months, but generally speaking, it's someone who at least has a life expectancy of 6 months or less with the disease taking its natural course.
Okay, home health.
Home health is a in-home medical service that is a very goal-oriented service. And the reason I say that is the healthcare provider goes into the home. The healthcare provider may be a physical therapist, an occupational therapist, a nurse, a wound care nurse, a social worker, and they are working towards a goal. And an example of that may be a skin ulcer. They're going to go into the home. They're going to help aid in changing bandages, perform wound care in the home to heal that ulcer. So once the foot ulcer or leg ulcer, whatever, is healed, then home health stops.
And generally, home health, and I know this is not a one answer fits all. That is something when you mention goals, it is usually maybe they come Monday, Wednesday, Friday, 2 hours a day, hour and a half a day, or to achieve whatever that goal is. And then eventually they go away. Correct? This is not something where they stay with you the whole time.
A care plan is developed early in the therapy,
right,
and continues throughout the therapy. And once the care plan is completed or a goal is met, then home health would stop.
Okay.
And to the latter would be the hospice benefit, which is a benefit covered by Medicare for terminally ill patients. And that benefit would continue for one of two reasons it would stop. Number one, the patient would pass on, the patient would expire, or patients do graduate from hospice. And graduation is a good thing. Graduation meaning your condition has improved.
Okay.
They may have been on hospice for a period of time, and the care given by the nursing staff has improved the condition so the patient is doing well and no longer qualifies for hospice. So typically a hospice admission will result in the death of the patient, but there are instances where the patient is taken off of the hospice program. And at that point, they have programs like bridge programs or just home health where services are sent out to the house and the patient is then cared for in the home. And really, home health is for patients who are homebound. So if the patient can get in their car and drive to their doctor's office or hospital or wound care center, then they do not qualify for home health.
So home health has not just going back and we'll just hammer out home health for a second. I know Toomey has a great home health department. They are located on Pinewood Road, servicing Clarendon, Lee, and Sumter. Open from 8 to 4:30 p.m. They also have 24-hour staff, 7 days a week. Main phone to call them would be 773-4663. And, Tri-County also has a fine staff there as well. And they're located here in Sumter. I think they cover exactly the same area. And give them a call as well. They're over on Tahoe Road, just off of Wilson Hall Road.
At 2560 Tahoe Road.
Yeah. And what we want everyone to understand with those, we'll talk about those two because we deal with them. I deal with them a tremendous amount with Reliable Medical Equipment, and we deal with them a lot with At Your Service. So as we come up on our third break, we'll continue to talk a little bit about home health and hospice, and want to thank our sponsor down at Colonial Family Practice as well. Go by there and to the what does Clay call the big hub there? Is that the on Broad Street?
The
mothership. So stop by and see all of the Colonial on the mothership, or stop by and see Dr. Mahler on
698 Boltman Drive.
And we'll be right back.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
We are back. Welcome to Medical Forum on this Saturday morning. And for all of you listening in, if you want to listen again, we re-air, Chris, as you know, on Sunday from 2 to 3. And as we were coming up on our last break, we were talking about home health and we were talking about hospice. And, just summing up the difference real quickly, hospice is something where we do see life coming to an end. And there are ways to graduate off hospice. There's a lot of knowledge out there to see if your loved one is, one, eligible, or two, that's the best line of attack with the disease or what have you. And home health, as we talked about, has many, many different aspects to it. But home health is when we're limited to our home. We can't get to an outpatient facility. It's intermittent daily care. You need to be under the care of a physician. So please see your physician. And you require either skilled nursing or assistance for your activities. And that encompasses so many things, from physical therapists to occupational therapists to medical social workers, speech therapists, home health. the list goes on. And two great friends of the show that we highly recommend that if this is something that you think you qualify for or just want some more information, give Kim Price a call over at Toomey Home Services. They can talk to you anything about home care from hospice to home health to, as Chris talked about, the Bridge program, which is something that you might want to inquire about, but it's kind of a different program. The Bridge is the same as a home health, except that the patient must also have a terminal illness. So there's all of those to fit your needs, but her phone number, 773-4663, and they're over on 500 Pinewood Road. Also, Medical Services of America, some of you might know them better as Tri-County Home Health and a hospice as well. Chris, I know you know them very well. They're over on Tahoe, Chris?
Tahoe Drive,
and the phone number is, and I'm pulling it up right now as we speak, 905-7720. Go over there and see Debbie Delilah, who does a tremendous job. And, I know their physician there is fantastic too, so especially with the hospice. So I'm sure you're going to be tremendously taken care of. So as we kind of change gears a little bit on our fourth segment, Chris,
I want to bring in the next topic that we're going to talk about, and I'm going to pull this from U.S. News and World Report. And this is directly out of an article that was written very recently, I believe today. And I'm going to kind of quote this article. And it says, there is a lot of evidence to suggest consumers are learning as they go, and I'm not sure it's without a lot of painful experiences. And this is in the context of talking about Obamacare and the new marketplaces for insurance. Mm-hmm. And that kind of brings us in a little bit into our next topic of conversation.
Absolutely. As much of any show we got calls about, and we'll talk about what was talked about when we had Bynum on. And we had Sandy Wilson, and who helps you with your auto, your home, your car, which we'll talk about that. And then we had Karen Schwartz on as well. And Karen talked about the open enrollment, Obamacare, your business, your health insurance. And Chris, as you read that article, I think Karen emphasized how important it is to utilize a place like Bynum. Number one, it doesn't cost you any money. So you're getting an expert. Karen's been in the business 20 years. Bynum's been around 55 years. And you get them for free.
Well, Karen said that you can use the webpage, and you can go on the webpage and sign up for your insurance. But if you have problems navigating that webpage, if you have problems or questions about payment, if you have questions about local coverage, which is truly important, i.e., what physicians in this town take this insurance, because the government webpage is not going to have that list specific to Sumter, South Carolina. And if they do have that information, I'm sure it would require some digging.
Well, let me tell you something. I'm going to use a fairly harsh word. If you are doing it independently, you are foolish. And I'm going to give you if you're a business and you have not called Karen or any of the other good people down at Bynum, you are not doing yourself, your business, or your staff justice. And I'm going to give you firsthand. Number one, we have used Bynum for over 10 years at Reliable Medical. I have over 17 employees down there. Every one of them has different needs, Chris. We have people anywhere from the age of 60 to 22. We have anyone that does not have children under their plan to having as many as 4 children. So one size does not fit all. Karen, in the last 3 years, as you know, insurance has skyrocketed. Medical insurance has skyrocketed. She's been able, by just sheer hard work, and her staff, she'll be the first one to tell you, it is her and her staff, from the Lauren Barclays to Kelly Pollocks to everyone working as a whole, and that starts from the top with Ed Bynum working with everyone. But personal story, 2 weeks ago, we're looking and our insurance is about to go up 15%. The first thing Karen said is, I'm going to continue to shop and find you a better deal. Secondly, we talked about Obamacare, and that's something that she brought up on here, and this will probably take us into the end of the show as we talk about some of the things that are going to try to give people advice. And she has offered, and it's a service that Bynum does. She's going to find us 5 different policies, with different deductibles. Number 2, she's going to do exactly what you said, Chris. She's going to tell us this is covered by these physicians in Sumter or this hospital or these specialists, which may be in Columbia or such. She's also going to tell us when they don't. The second thing that they do is she will sit down with them on an individual basis, because with Obamacare, sometimes it's a better deal and you can get the same services that are out there to pick and choose them. So they're there to get you the best deal. If she can save you money in a group policy, wonderful. I know that she has worked diligently for us the last 10 years to keep these soaring medical costs very comparable every year. But additionally, this year, because as they continue to rise, and we just got back a quote today, 2 weeks ago, 15%. So we're going to be having to look at different insurance carriers. And what's great about Bynum, Aetna, Coventry, Humana, Cigna, Blue Cross Blue Shield, they cover them all. And it costs you nothing. Most people out there think that if they go to a Bynum or a local insurance agent, that they're going to pay higher. It's just not true. And I think that's what she emphasized to us.
And just a couple of things about Obamacare. A lot of people would really think of Obamacare as just a strictly political issue. Obamacare comes from the Affordable Care Act, which was passed by President Obama.
Tell you what, Chris, because we're coming up short on a break, and I knew that we were going to do that because I rambled on, but I felt it was so important. But as we come back from this and coming up on our last break, let's continue to talk about Obamacare and see if we can help everyone listening out there kind of give them some advice and how to follow. And we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And welcome back to Medical Forum. Thank you all. And if you're all just joining us, Chris, when we left this last segment, we were very passionate about talking about all the things that Bynum can do for people here and how critical it is to get advice on this. And you were starting your discussion about Obamacare.
Yeah, Obamacare has been more of a political discussion in often cases, and not as much as what it really is. And patients question this to me all the time: what did it really do? What did it really add? Other than providing a new group of people the option to have insurance. However, Obamacare goes a little bit beyond that, and really what it does is, to kind of rehash, it was passed by the Affordable Care Act, which is what instituted Obamacare, and there's a lot of issues that the Affordable Care Act has done to improve the overall healthcare arena. One of those is allowing young adults to stay on their parents' healthcare plan until age 26. That is a
what it used
extension.
To be. Was it 19? Or unless you're in college?
I think it was a little bit different for each insurance plan. I think you had to be a full-time student, and I think there was probably an age cutoff, probably in the maybe 2021, something to that effect.
But if I say not 26.
Yeah, but it was. Yeah, it wasn't 26. So definitely that's an improvement. And a lot of these kids might be in college, undergraduate, or graduate school, and certainly do not have the opportunity to get regular insurance, so they can stay on their parents' insurance a little bit longer. The ACA Act also prevented the denial of coverage or charging more based on health status. And
so no pre-existing.
Kind of, eliminating pre-existing. And, we'd seen that in the past.
Yeah.
I had a knee injury 10 years ago, and now I can never get coverage for my knee injury, and everything has to be covered. Or, of course, chronic medical conditions like diabetes and hypertension. The ACA Act also states that it prevents gender discrimination, stopping insurance companies from making unjustified rate hikes, which I think is a little bit of a question, because there's been some incredible rate hikes in the last 2 years since we've had the passage of the Affordable Care Act. I don't know where all those rate hikes are coming from. I don't know how justified those rate hikes are, but based off of the Affordable Care Act, it says that it's stopping insurance companies from unjustified rate hikes. Doing away with lifetime and annual dollar limits. And so the case came up several years ago, and I believe it was actually a politician whose family member needed a bone marrow transplant, and they exceeded their lifetime out-of-pocket limits, which was either $1 or $2 million. And so once that happened, that came right to the forefront of attention, and that was part of the Affordable Care Act too, so that there are no lifetime limits or dollar amounts. Giving you the right to rapidly appeal the insurance company decision. So if an insurance company denies something, you have the ability to rapidly appeal it. Expanding coverage to tens of thousands was the goal of the Affordable Care Act, and the goal was to subsidize health insurance costs through health insurance marketplaces, i.e. healthcare.gov, and state-run marketplaces. And so we know that's a very hot topic in South Carolina, especially because of the state's ability to accept or reject a state-run marketplace. Also, the goal was to provide tax breaks to small businesses and require large businesses to insure employees.
In large business, I think in the context of that, if you employ 50 people or more, and what constitutes a full-time employee is 30 hours or more. So if you're under those categories, then you're not by law. And the penalty, if you are over and you don't offer, you don't have to pay for it. I think that's sometimes when businesses get a little upset. They think, oh my gosh, that's an expense that I have to bear. It's not. You have to have a plan and you have to offer it. It doesn't mean that you have to pay any of it, but you have a responsibility to do what most people do, and that is to consult someone like Karen and say, all right, I've got 75 employees. Tell us the best insurance plan to look out for all your employees. One of the other misconceptions, Chris, is the enrollment. And they pushed it back for a couple of years, but you had enrollment that stopped because there's really only about a 30-day window. And I think one of the things that Karen talked about, February had what's called open enrollment, February 2015. There's another open enrollment, and this is August, but November will be here before we know it. And you have a 30-day window for 2016. So anyone listening out there, You have to enroll if you do not have insurance, and or the company you work for does not mandate that they have to. In other words, if you work for a company that has less than 50 people, or you're a 30-hour employee, you're going to be responsible for that. And enrollment for 2016 begins November 1st, and you must be enrolled by December 15th of 2015. And we've sat here and glossed over it, and we probably got 2 more minutes and probably 2 hours worth of conversation to put into it. Don't try to figure it out on your own. And even if you're highly intelligent and feel like you can do it, still sought out a professional, because they may be able to save you money. And there's silver plans, bronze plans, gold plans,
and accommodate for all those local issues that we talked about.
Yeah.
Who in my town takes this insurance?
Absolutely. Yeah, you might be able to vector through and go, wow, this is perfect. It's right in my wheelhouse, and it doesn't cost as much. And then the second you need it, whether you go to the hospital, physicians, a surgeon, what have you, and they said, we don't accept this. And then you look and find out this great plan that you got to go to Georgia or North Carolina to get serviced. And sometimes it may just be that 3/4 of the physicians that you see fit in the wheelhouse of your policy, and you're just going to have to then pay out of pocket then when you see a specialist who doesn't, especially if you like your doctor. So one of the things that you can always keep your physician, that's just not entirely true, is it?
Absolutely not.
Yeah. And some people, you hear about, well, what if I don't do it? I mean, what's really going to happen? Well, just from a simple math standpoint, if you do not sign up for insurance, it's $695 per adult per year. If you also leave your children without insurance, it's $347.50. So
that'll be assessed when it's time to do taxes.
When you do your taxes and you think you're getting back $695, you're going to get back zero.
Yeah,
just using a real simple math example. But, it's a very complicated, and I think the moral of the story is that read up, be knowledgeable. I totally believe that people should do that, and then take it to Bynum Insurance is what I would do. That's what I did. Not what I would do. It's what I did. And Chris, as we come down on the show, want to thank Toomey for all the things that they do. Want to thank our sponsor, Tri-County MediHome Services, for all that they do. And Bynum Insurance. I don't think that we can echo enough the value of having a local insurance company here. And the hour goes by quick. And I want to thank all of our listeners out there. Dr. Marr, thank you for coming in again. And we'll see everyone next week.
Have a good weekend, Jeff.